lines is psychotherapist Dr. Robi Ludwig. Good to have you with us, Dr. Robi. Happy Giving Tuesday. I mean, research has consistently shown helping others can be good for your mental health. Our email boxes are flooded this morning with all of those messages from various organizations maybe we've had contact with over the years. It does kind of give you a boost to think how you can help them. Why do we feel so good about that? And what are some of the ways people can give back today?
The studies are really consistent that when we give of ourselves in a charitable way, we feel less depressed, we feel less pain. It impacts that part of our brain that just helps us to feel better and more connected. And now is a really good time to think about, what do you feel passionate about? What is important to you? And how would you like to be a part of a community that makes other people's lives better? You can think of it in terms of that, or you can think of it in terms of the people in your life who you'd like to spend more time with and appreciate more. But it's a great time to think about, how can we serve? And it also not only helps others, but it really helps ourselves. We can give blood, we can donate to nonprofit and community organizations, pay it forward, and it's a good reminder to always give kindness.
It is such a good reminder, especially after we've spent so much money on Cyber Monday and Black Friday, just buying things sometimes that we don't even need. To give back is a good idea. Okay, let's look at this. This is an interesting one. It's a new documentary. It's dealing with postpartum depression and psychosis, but it's comparing it to how witches have been represented throughout history. It's striking a chord with a lot of people, getting a lot of buzz, as these conditions can still be poorly understood. Walk us through this.
I loved it. The person who created this film suffered from postpartum depression and made the connection, looked historically at witches, and many of the witches were just suffering, or people who were considered witches were considered, actually suffered from mental illness or epilepsy, and their medical illnesses were not understood and therefore demonized. And the truth is, we still have a lot of expectations surrounded around motherhood, and we like to connect it to this perfect imagery for our own psychological needs. And so it's very important to stop and remember, when we don't understand an illness, to not demonize it. That's what made getting mental health services so difficult historically. It was connected to an inner demon. That was the thought process. And to look at it medically and not to ostracize somebody who is different or struggling.
Good advice there. All right. Finally, if you need some alone time during this holiday season, you're not alone. An Ohio State University survey found out 56% of Americans say that it is vital to their mental health having that alone time. Talk about the benefits of taking time for yourself.
It certainly is. So this is when we choose alone time. It really allows our brain and our mind to reboot, to really plug into ourselves and to think about what's important to us. What do we need? What do we want? How can we set boundaries? It also allows us to get in touch with our inner creativity and reduces stress and anxiety that sometimes can happen when we're in the presence of others. So it allows us just to be with ourselves, understand ourselves, and it's a very important aspect to feeling healthy and emotionally regulated.
Dr. Robi Ludwig, some great advice as always. Thanks for joining us this morning.
Thank you. Happy Tuesday, guys.
Yeah, happy Tuesday.